This is the most exciting time in the Cure Kids calendar, is when we pull the research community together to say, bring us your best and biggest exciting projects for the health of our children. And so this year we've selected 5 amazing research projects across a diverse range of conditions that are stopping our children from living their healthiest, best lives. 2 are closely related to our most vulnerable tiny little Kiwis. So looking at babies that are born preterm and those that are born with oxygen deprivation, and making sure that we understand a little bit more so that we have much better long-term outcomes for those tiny tots.
Hi, my name is Petra White. I'm a postdoctoral scientist at the University of Auckland. We're researching using a preclinical model of neonatal inflammation to try and work out the mechanisms behind brain injury. Now, this is a mild form of brain injury that's very common in preterm infants, especially when they're exposed to infection or inflammation. So what we're trying to do is provide, firstly, a mechanism by which this brain injury occurs, investigate that, and then see if we can look at the potential for delayed treatment. This research is really important because many preterm infants experience this mild form of brain injury that we can only detect months to years after the point where it happens. Importantly, this could pave the way for future clinical studies which would be life-changing for these children and their families.
The third one that we're funding is looking at enhancing surgical procedures for children with rheumatic heart disease.
My name is Massimo Caputo. I'm a British Heart Foundation Professor of Cardiac Surgery. This research project is called Understanding and Improving the Surgical Outcomes in Children Undergoing Aortic Valve Replacement due to Rheumatic Heart Disease. Our project aiming at improving the understanding of why these young adults' valves are affected by the rheumatic fever. And the second goal of this project is to see whether new surgical techniques can help improving the results of replacing some of these valves in this young population. The research is very, very important, especially in New Zealand, where when I arrived, I discovered a huge number of young adults with rheumatic heart disease, especially in the Maori and Pacific population. So we want to evaluate procedures that are using the patient's own tissue to create the valves. The importance of this funding is that they give us an opportunity to start trying to gather data which will be fundamental for a much larger trial in the future. My main message to founders and the people support Cure Kids is that without their money we won't be able to make any advance in research, and especially in a group of patients like children and young adults, having the support of charities like Cure Kids is really fundamental.
And then a really important area that's impacting a huge number of our rangatahi is mental health and addiction areas. We're looking at a research program enhancing our health services for adolescents who are really struggling with mental health and addiction. And then we have this beautiful population of children with autism. How do we provide a really integrated approach to healthcare services for them? So you've heard about some of the exciting projects that Cure Kids is funding this year. And we're so proud of the association that we have with these amazing researchers and the beautiful work that they're doing that is really going to improve the lives of our tamariki. But we couldn't do it without you, and we're really empowered by the fact that your generosity enables us to do this amazing work for our children and our future.